so much for joining us today as we discuss the importance of insights into older adults and the demographics and their health needs. This webinar is being offered today by the Ottawa Valley Ontario Health Team and its members. And the OVOHT is made up with more than 50 local health professionals, healthcare providers, organizations, and community members who are working together, to improve our health system, connect patients to the services that they need. Ontario health teams are a coordinated way of organizing and delivering care that is more connected to patients, families, caregivers, and to their local communities. Today's session is being provided among three webinar series before we launch our one-day Aging in Place Forum on May 15th, which I will put into the link into the chat. If you haven't registered, we would love to see you on the 15th of May. And that full day event will bring together healthcare professionals, service providers, policymakers, decision makers, and community members to work together to create a shared 10-year vision for aging in place across the Ottawa Valley. I'm happy to be your moderator today as someone that's worked in the healthcare system for over 25 years, seeing multiple layers of planning and system integration. I'm pleased to be here today to represent the OVOHT team. I'd like to acknowledge that the Ottawa Valley Ontario Health Team and its partners are located on the traditional, unceded, and unsurrendered territory of the Anishinaabe Algonquin people. And we take this time to express our gratitude and respect to these people and the land for all that it has provided for us and continue to provide. I would love to turn it over to our speakers today, Brian and Kate. Brian Snart is passionate about the power of data to support and drive change. Brian's responsible for our performance and analytics portfolios. He helps ground and focus our strategies, planning, and accountability with performance measurement, evaluation, and data analysis. Brian not only works with our Ontario Health Team in the Ottawa Valley, but also works with Archipel. And so, Brian, thank you for joining us today, and thank you for your leadership today. And Brian's co-pilot today is Kate, the Director of Health Information Systems at Renfrew Victoria Hospital and St. Francis Memorial Hospital. Kate entered the healthcare field in primary care, managing several medical clinics and family health teams before moving over to the hospital sector. Kate's found her niche in the area between clinical and technical by first supporting a multi-hospital learning management system rollout before taking on the role as a project manager for EHR, electronic health record implementation at several local hospitals. So I'd also like to thank Kate. Kate and Brian, thank you so much for taking us through this presentation today. I would welcome questions in the chat. I will do my best to monitor, and we will respond to questions at the end. Brian and Kate also have a number of poll questions during our time together today that we will take a peek at and look at the answers and see how well you do. And I'm now going to turn it over to Brian and Kate.
Hey, thank you, Lisa. Nice to see your face, or I guess your names in boxes, most of you. We have for you today a data-focused presentation, well, maps and graphs and data. Going to provide you an overview of older adults in our region, and Kate and I will alternate. You're seeing the slides? Give me a nod, Lisa. We'll go through the data slides. Like, it's really intended as a kind of, as Lisa said, as a baseline for our discussions on May 15th, kind of set a common ground. And maybe the data will be useful to some of you in other ways as well. In addition, we're hoping for a bit of a discussion at the end, hear what your takeaways are and your thoughts about this. And then a little bullhorn there is just to flag that there's a lot of new, or at least newly compiled data here. So I'm happy to be sharing it with you all. We'll start with demographics. Then housing, then look at health conditions and risk factors, and then a bit of a deeper dive into healthcare, with a drill in on Renfrew Victoria Hospital data, since that's where Kate is from. We'll finish by looking at some rural issues, and then look forward to a good conversation, I hope. But we have, as Lisa said, 8 quiz questions along the way to test how well you know the Ottawa Valley, or seniors in the Ottawa Valley. And the answers will be revealed so long as you stay tuned, and that's our little trick to keep you engaged, hopefully. I'll be watching to see how well the quiz numbers go as we go along. You may want to keep track of how many you get right, because at the end, the winner, well, I don't know, it's not much of a prize, but we'll write your name on a virtual trophy. So just before we get into the data, just a little bit of context about what's here and what's not here. Aging in place, like this is a really broad theme. It goes way beyond healthcare. Aging in place, looks at everything from older adults' physical activity to home modifications and assistive devices and transportation and finance and reverse mortgages and all kinds of stuff. But like our focus today is really narrow piece. It's the health system, or parts of it anyways, that I circled, and demographics. That really kind of is a reflection of our role as an OHT around population needs in the health system. And then just a note about some of the data. Some of it's for Renfrew County, some of it's for the health unit, some of it's for Ottawa Valley OHT geography. Those 3 are all kind of overlapped, but different slides have different geographies. Okay, over to you, Kate.
Thanks, Brian. So Brian, and I guess maybe I should double check that everyone can hear me. We're good,
Yep.
Lisa? Okay. So Brian said the word data several times because, for better or for worse, we're stats people, not clinicians. So I'm going to prepare you up front for a fair. So Brian, number of graphs, as Brian mentioned, but they're colorful, so hopefully that helps. So in our initial slide on demographics, we can see the percentage of 65 plus per county. We're in red in Renfrew County, with all of Ontario in green at the top. And as you can see, 1/4 of Renfrew County population is 65 plus, which is higher than the provincial average, but similar to other rural areas. At the bottom of the graph are the more urban areas, which tend to have the smaller proportions of older adults. So mainly around Toronto, but Ottawa is there too. Now that we know where we sit for the 65 plus compared to other counties, let's look at age and gender as distributed within the county. So here we have a graph with a bar per age group current for 2025, but also divided by males in blue on the left and females in pink on the right. Note the baby boom and the echo generations, so ages 61 to 69 and 28 to 44. Between those two, we have people like Brian. I'm part of the echo generation, but I think I'll leave out the details of where exactly I sit in that group. You can also see the tighter bands among young adults who, to some extent, move away temporarily or long-term for work or school. And note also a bit of a rightward lean at the top with women living longer. Now, try and picture what all these bars will look like moving forward in time, because our first quiz is here. So quiz number 1, and I believe Jema will be putting it up for Brian. Yeah, so between 2025 and 2035, the Renfrew County population aged 60 to 69 will A, increase by 6%, B, increase by 12%, C, increase by 22%, or D, decrease by 19%.
And I'm just watching the numbers coming in.
Okay.
We're up to 15 right now.
Okay, so let's
20,
give it another second.
23, give it another second. We'll sort of figure out the pacing of this thing.
Sure.
Okay, it seems to have slowed up a bit, and here's the results. Share results.
Great. So most people voted for B or C. However, the actual answer is decrease by 19%. So you can see that in this next graph here. And maybe I'll just start with, again, kind of giving you an overlay of what this view looks like. So once again, we have our blue and pink bars from before. Overlaid on that now are those black bars, representing what the age populations will look like in 2035. So as alluded to, the baby boomers that were 61 to 79 are now 10 years older. So in fact, their age population will go up 41% compared to what it is now, which you can see in those black bars. And then tied to the question is that smaller group between the boom and the echo, including Brian, they will now be in their 60s, leading to a decrease by 19% of that age group. So all of those ages shift up. So as a result, we have this interesting scenario where in 10 years, we will have considerably fewer people in their 60s, however, significantly more that are 70 years and older. And we're hopping right into quiz number 2. So, which municipalities have the highest proportion age 65 plus? A, Pembroke, Petawawa, and Laurentian Hills. B, Madawaska Valley, South Algonquin, and Head, Clara, and Maria. C, Renfrew, Horton, and Amiston, Bromley. Or D, Arnprior, McNabb, Braeside, and Greater Madawaska.
Okay, we got 22, 23, 24, 27, and holding there. Okay, sure.
All right. Let's go for it. So most of you were correct. If you guessed B, Madawaska Valley, South Algonquin, and Head, Clara, and Maria. So you can see that in this slide. So the farthest reaches of the region have the highest proportion of older adults, and that's in that dark orange color there. These are retirement communities with relatively few opportunities for the work and education that would tend to draw young families. You'll notice the one sort of variant there is Petawawa, which is unique because of the draw of the base, which brings in those that young population. So I am getting all the quizzes. We're moving on to quiz 3. Seniors in Renfrew County are more likely than younger people to be immigrants. A, true, or B, false?
Okay, we're up at 15, 19, 21, 22, 24. Give it just another 3 seconds. Quick, and let's stop here. Share results.
Great. So you may be surprised by this, which it looks like 81% of you will be surprised. So the answer is true. So you can see here, so just to give you a lay of the land of this graph, we've got 3 different kind of colors here. We've got the Renfrew County 65 plus in dark blue. We've got the Renfrew County of all ages in light blue, and we've got Ontario 65 plus in the green. So if you look down at the immigrant section, you can see that the 65 plus have a higher percentage of immigrants than Renfrew County of all ages. This is an indication of the history of the region, with earlier waves of immigration coming from the UK, the US, and Europe. If you have any questions about this, please direct them to Brian. Being an older adult in the older age group, he probably knows this history better than I do. The story is a bit different when we look at recent immigrants. They are typically younger and include many from India, the US again, and parts of Asia. And of course, compared to the province overall, immigration is quite low here. Something else to just highlight before we move on is the higher rate of low income among Renfrew County seniors. So you'll see that at the top section, low income after tax, the dark blue is larger than the light blue. Which again, we've highlighted in this map. So low income among seniors is not evenly distributed among Renfrew County. We see very high rates in Pikwakanagan and relatively high rates in those same farther reaches of the region as our high percentage 65 plus population. So again, Madawaska Valley, South Algonquin, and that western area of the county. Just to make a note of the two different legends here. So the colored regions are in terms of percentages. And that's the lighter versus darker colors of the orange and peach colors. In terms of sheer numbers, you can look to the circle sizes. So those rings of Pembroke and Renfrew really stand out with significant numbers of low-income seniors, but not compared to the percentage-wise. And I'll hand it over to you, Brian.
Yeah, let me drill in a little bit about seniors housing. About 2/3 of older adults in Renfrew County live with their immediate families. That's mostly people living with their partner or spouse. 1/4 live alone. This can be an at-risk group sometimes, depending. And then you have about 7% in collective dwellings, be it long-term care, retirement homes, or other. And we'll drill in on the long-term care and retirement homes in a couple of slides. So here we're looking at the proportion and also the number living either alone, or most of the cases living alone or with non-relatives. And you can see the proportions are high in Horton. I'm not sure I understand, and the Quacknagon and South Algonquin. And of course, as Kate was saying, sheer numbers are bigger in Pembroke, and that's just a reflection of the population size there. Drilling in on long-term care. So what we've done here, first of all, the red buildings are the locations of the long-term care homes, numbered 1 through 9 on the map. And then for each sub area, you see these 5 sub areas: Deep River area, Pembroke Petawawa area, and so on. We summed up the number of beds. So you see in Deep River area, 34 beds. And then we calculated a rate per 1,000 people aged 75 plus in that area to get a kind of a ratio. And you can see, of course, Deep River is the lowest at 4.6. Pembroke Petawawa area the high, Renfrew Eganville area the highest at 9.3. But notably, I'm sure most of you know this here, Four Seasons will be expanding to 96 new beds. I don't know the timeline, but I know it's soon. So Deep River will be looking very, very different in not too long. And then I want to draw your attention to the gray box. If you take all these sub areas together, we've got an 8.5 per 1,000, which actually looks relatively good compared to the Champlain, Southeast, and Central East Lynn areas that surround us, which may come as a bit of a surprise, but I'll say the next graph tells a different story. So let me skip there. This is the wait list for long-term care for Ottawa Valley in red there as a per capita. So the proportion of the population waiting for long-term care. And as you can see, Ottawa Valley has one of the highest unmet needs for long-term care beds, according to this. The previous slide showed us good beds per capita, but this one shows high levels of waiting per capita. And we asked at the Quality Improvement Committee, where we kind of tested out these slides a couple of weeks back, and they were pretty clear that this is a reflection of the relative lack of community services and alternatives to long-term care placement in our region. This is the theory there. Maybe you have others. If this is looking at the last 3 years, we can see the long-term care wait situation has been getting worse. There's a number of people in Renfrew County waiting, while the number waiting in hospital has stayed relatively low. Number waiting in the community has been on the rise. Okay, and then here's some new data for me anyways, retirement home data. We asked all the retirement homes in the region to share their information, and I was surprised they did so immediately and quickly and without any hesitation. So you see the homes here numbered 1 through 12 across the region with the little red house. For each one, we have the count of the units, which then I've summed up into those little boxes for each of the sub areas. Some of the units might host 2 people, but we just counted units here. As you can see, no retirement homes in the Deep River area. However, the population is the senior population is the smallest of our sub areas in that part of the county. Based on both the number of homes and the per capitas, we're sort of best served in the Pembroke Petawawa area on a per capita. So this is interesting new data. Let me drill in now on some information about the health of the population, risk factors and health conditions, above and beyond what Kate's already shared in terms of living alone and low income. Actually, we're on to our next 4th of 8 poll questions here. So across different risk factors, we compared Ontario seniors with Renfrew County District Health Unit seniors. For which risk factors are our seniors actually better off than the Ontario average? A, overweight, obese, B, smoking, C, alcohol use, or D, sense of belonging to the local community. Again, which one are we doing better on? Just give it another few seconds. And the results are unambiguous. Almost all of you chose, all but 2 of you chose sense of belonging to the local community. And you would be correct. So sense of belonging to the local community is higher both compared to Ontario and compared to younger folks in the region. If we just look at the first column and the last column, the older adults in Renfrew County and in Ontario, we see here we have higher rates of overweight, obese, heavy drinking, and lower vaccine. And you see actually smoking rates are pretty tied, they're tied there. However, there's a huge confidence interval around that number. It goes from something very tiny to something very huge. So I wouldn't make too much of it, although a couple of you did guess that. And then in the blue at the bottom, we see seniors here are more likely to be attached to primary care than younger people, which is encouraging. Okay, a few health conditions here. We selected just a few. Ontario residents in green, residents of this region in blue. Our local rates are higher for all of these: diabetes, mental health, heart failure, falls, palliative, which is not really or death rather, it's not really a condition per se, and COPD. In the case of diabetes, we're talking about 1/3 of the senior population. For mental health and addictions and heart failure, we're talking about 1 in 10. Of course, this is just a subset of conditions. We know that the number of conditions you have can be often even more impactful. So we're looking at that next here: frailty and multimorbidity. These are strongly associated with healthcare use and healthcare costs and risks of hospitalization and risks of long-term care. As you can see here, our older adults are more likely to be frail than Ontario overall, and by the time they reach 85 to 94, more than a quarter are frail. There's a detailed definition of what's counted in frailty in the bottom, and we'll share the slides after. For multimorbidity, defined here as 3 or more chronic conditions of a list of 17. This data is a bit older and it's for Ontario overall, but it does paint a pretty clear picture. By 80 years of age, 3/4 of us would have multimorbidity. A more recent study showed that multimorbidity rates are on the rise, and other studies show that folks with multiple chronic conditions, no surprise, consume a high proportion of healthcare services, a disproportionate amount, and that these things are more pronounced. The healthcare use is more pronounced for older adults and those from low-income neighborhoods. Also, like, no surprise, I'm sure. Okay, so I just kind of drew the links between health conditions and health service use. Like, let's look a little deeper at health services. This is real data for Ontario overall that shows quantitatively what we all know sort of intuitively. The older you get, the more health services you incur on the average. These are all averages, right? Just one exception there for babies, like mostly during the first few days of their life, some of them can be hospitalized. So 65-year-olds on average cost about twice as much as 45-year-olds, and 80-year-olds twice as much as 65-year-olds, and 90-year-olds twice as much as 80-year-olds. So anyway, not surprising, I suppose. So quiz number 5, let me pull that up now. So thinking about people 65 and older in this region, they make up more than 85. So remember, they're 25% of the population. They make up 85% of activity in specialist visits, in Ontario Health at Home personal support and homemaking, or renal dialysis, or oncology. Okay, we're up to 19 responses, 20. Give it another second here. So we're maintaining relatively good continuity with the folks here. So nice to see that. Okay, let me show you what we got for results. The bulk of you chose personal support and homemaking, and you'd be correct. And a good number of you chose specialist visits. So let's look at that data in more detail now. Are you seeing slides? Yes. So the top bar, that's the population, 25% is 65 and over, and all the other bars are what proportion of the activity is represented by folks 65 and older. And this is all Renfrew County residents. Okay, so the arrow, the green ones are all home care, different, so the major activities in home care. And that one, personal support and homemaking, is really makes up the lion's share of home care spending and home care visits. And of course, it's mostly seniors. In red, you see inpatient hospitalizations. Seniors predominate there as well, but not in designated mental health beds. That's a different profile. In orange, kind of a little bit to my surprise, people over 65 only are slightly overrepresented in the emergency department. Don't know if that surprises you too. And finally, in purple, older adults are overrepresented in physicians' offices, but not nearly as much as in hospital and home care. And a kind of a bonus quiz for you. You could pop it into the chat if you want. We don't have I don't have a bar here for long-term care. What proportion of long-term care residents do you think are 65 and older? It's not 100, but what do you think it is? And I'll just wait a couple of seconds if anyone wants to guess in the chat. 95, says Aaron. Okay, pretty close, Aaron. It's 94. So we used this data. We have detailed data for every service, of all of these services anyways, by each specific age group. So we know what the age specific use rates were for ALC days, for day surgeries, etc. And we use that to walk it out to 2035. So this next graph here takes those age specific rates and applies them forward. And in short, you know, the services that we saw on the previous slide where seniors predominated are the ones that we expect to grow the most, which makes sense. Deaths, home care, personal support and homemaking in particular, complex continuing care, obviously this is all intuitive. So this is the pressure that is coming, and in not too long. And if you want to divide it out over 10 years or 12 years, you can see what percent increase year by year as well. I will say though that this is all predicated on those age specific use rates staying the same, but historically they haven't because of constrained resources. You know, you can't have more people in beds than you have beds, for example. So while this might be the pressure that's coming, we won't likely actually see this level of volume increase in the real world. Like if I had done this projection 15 years ago for today, it would have been wrong to some degree, right? Okay, I alluded earlier to community supports for older adults. This is a bit of imperfect data, but I think it's interesting data. So here's how to, so read this row by row. These are 4 of the services, for the service categories that community support service agencies provide, of 4 out of a much longer list. And what we're comparing here is the per capitas, or rather per capita 75 plus, for assisted living clients, for Meals on Wheels, for respite care, and for social and congregate dining visits. And you can see in green, for example, that Deep River and area looks to be relatively better served, and in red, it looks like Pembroke and Petawawa seniors are relatively better served for Meals on Wheels. But there's a big asterisk there on the right, to note that there are some, let's call them equivalent or similar services not captured in the data, right? There may be some respite care offered by Home and Community, by Ontario Health at Home, CCAC, LIN, whatever you call it now. There'll be some neighboring services that are not captured here. So this is a partial picture, but I think it's important because what we want to do ultimately is to see where are we relatively well served, where are we relatively less well served, and how do we address any inequities. But like I say, we need more data to be more sure. And one more sort of methodological comment on this. This doesn't tell you what the right amount is, right? Because we don't, for the most part, have standard benchmarks that we can use to say we need this many assisted living spaces per this many population. Okay, I went a little bit policy wonk there. I'll pass back to Kate.
Thanks, Brian. So pivoting a little bit, here we see the percent ALC, which is defined as the number of days that patients spend waiting for an alternate level of care in acute care beds as a proportion of all bed days. So we've got all of Ontario in the blue and Renfrew County residents with combined hospital data in red. As you can see, rates are lower for Renfrew County compared to Ontario, and have stayed low in this region for the past 3.5 years compared to Ontario. So, you know, that's pretty positive that we are providing that care outside of the hospital in order to be able to have those ALC patients being able to stay at home. If you take that graph and divide the Renfrew County data into our sub areas, you can see them here. So we have the highest rates in Deep River area and the lowest in Arnprior and Barry's Bay. You can also see some fluctuation over time. High rates of ALC speak to the efficiency of patient flow and the availability of resources for patients who are no longer requiring acute care, but haven't yet been able to transition to another location or be discharged home. So this can certainly have an impact on hospital resources, but for the purpose of this presentation and the upcoming forum, we want you thinking about what this means for community services in these areas, as well as access to alternate living arrangements, not only from a discharge planning perspective, but also strategies for preventing the admission of those patients to that service of ALC. Since I'm here representing Renfrew Victoria Hospital, we thought we would show a couple of quick snapshots of our ALC population. So the first is by discharge destination. You can see most of our ALC patients get discharged to a long-term care home. And also by length of stay for discharge destination. We have a relatively small volume of ALC patients, but they do stay admitted for quite some time. Actually, it might be a little fuzzy there, but I believe it's 93 days in the dark blue for home, 75 days in the pink for long-term care, and again, somewhere around 90 days for an unknown discharge destination. Yeah, so we are at quiz number 6. The most common need among ALC patients discharged from RVH was, and if you'll take a guess, A, respiratory, B, medication, labs, or therapy, C, mental health, or D, feeding.
Okay, numbers are coming in good. We're up to 16, 17, 18, 19, and 20, 22. Okay, some laggers, Okay, let's show this then.
Sure. So most of you were correct at 55% for medications, labs, and therapy. So many of our patients rely on someone else to administer their medications for them. So this is a service they need to have in place wherever they are being discharged to. So that keeps them in a hospital while we're waiting to make sure that that service can be reliably and consistently provided for them. And you'll notice actually that feeding is secondary there in the bright pink.
Okay, this next, and this is our last section, looks at, well, we've already touched on some rural issues in a way, but looks more directly at some rural issues of our rural geography. Let's start with the 7th of 8 quiz questions. Is Ottawa Valley the most remote OHT in Ottawa's Ontario Health's East region? There's 12 OHTs in Ontario Health's East region. Are we the most remote, yes or no? All right, we got 24. I'll show you what you said. 63% said yes, 38% said no. And the correct answer is yes, but not by a ton, right? Like Ottawa Valley has some very remote areas. This shows like a statistic. There's other ways to measure this, but this is the remoteness index from StatsCan for each census subdivision, basically municipalities for us. You can see, and you can see from the color, of course, Algonquin Park is on there giving a visual dominance, but there's a link in the deck if you want to know more about this metric. But those 3 OHTs just to the south of us come close in terms of their total remoteness index score. So this here, this is not necessarily strictly a rural phenomenon, but rurality and lack of health providers do tend to coincide. So I put it here. What we see are per capitas for certain healthcare worker types in Renfrew County versus Ontario. We actually, I was surprised to see this, have a higher rate of that category that includes personal support workers, the one at the top. And we have a slightly better rate for nurse practitioners, but the small numbers there. For everything else, we're in a worse situation. We have half as many GPs on a per capita basis. We have even less than half as many specialists. For nurses, we're about 15% lower. Pharmacists and dentists were lower. Maybe on top of this, what's not factored in here is where these folks actually work. This is where they live in the county. If they're working in Ottawa or somewhere else, we don't capture that here. And I don't know, I'd be curious about what the relative inflow and outflow is. Like, do we have Ottawa folks coming into Arnprior Hospital, or do we have more Arnprior staff going to Queensway? I don't know the answer. So here we're looking at and we're almost through our slides here. Here we're looking at the drive time to the closest hospital. This is generated by my mapping software. I think some of you might dispute some of these drive times, and I bet you can drive it faster than what's shown here. So anyway, my GIS software says what it says, but suffice to say, there's a significant number of people who are a good hike from hospital and also other types of services, and those without transportation or easy access to transport are at a significant disadvantage and potentially at risk. So that 1 in 7 figure, it's based on what you're seeing on the map here. Is it really 40 minutes from Whitney to Barry's Bay or the hospital on the other side? I'm not sure, but we're in the ballpark. Okay, last quiz question. I gotta pull that up for you. What do you think, take a guess, the proportion of Ottawa Valley residents of their specialist visits that were to Ottawa-based doctors. And we're not counting virtual visits here to Ottawa-based doctors. This is a kind of a bit of a sentinel measure, kind of gives you a sense of gaps. Okay, we're at 19, 20, and 21, I'll stop it there. So the largest number voted for 38%, and then 24, and then 16. And the largest proportion were correct. About 4 in 10 specialist visits by our residents were to doctors in Ottawa. And as I say, that excludes the virtual visits. On top of that, 1 out of 4 of those Ottawa specialist visits was within a month, but not within a day, between 1 day and 29 days or something, of another visit, meaning that person made 2 trips in the month or more. And there's a sizable number of people who had 12 or more visits to Ottawa-based specialists in a year. And I'll just add a little bit, there's more in the footnote, but we excluded ED visits here, and we excluded hospitalized patients here. So we're really talking more or less about just clinic visits. So again, this points to the need for transportation supports, but also to repatriation of services or to recruitment, more virtual visits, and of course, occasional specialist clinics, like those are among some of the solutions. So to sum up, this slide just pulls forward a few of the key findings that we noted. The rapid growth of the 70+ population and the related healthcare demand that's coming, older adults living alone and with low income, long-term care wait list, health issues being higher, challenges in the distribution of services, both between regions and within region, health workers, distances in general. And then the green bubble there, like very, very obvious takeaway for me, it's almost not worth saying, like we collectively need to meet the growth needs, including thinking about upstream strategies. We didn't talk too much about that explicitly. And we need to collectively address the inequities across the region, ensuring that the services are aligned with the needs. So like I said, that was pretty simple, obvious kind of conclusion on my part. Interested in your more nuanced and sophisticated thoughts on all this.
I would really like to extend my gratitude to Kate and Brian for the work that you've done to pull this together, and we will certainly share the presentation, not only to this group, but on our OVOHT members site as well. Thank you all for taking the time and being with us this afternoon.